Hello, everybody. Welcome to our Testimony Tuesday program. Tonight, I am here with Dr. Lourell Sutliff. Dr. Sutliff serves on the Care Board of Directors, and it is an honor to have him here. He's got a brilliant mind and a huge heart for the pro-life ministry that we serve in. So, Dr. Sutliff, thank you so much for joining our program.
Thank you, BJ.
Thanks. So let's just dive in, and I'll just first kind of ask, what brought you in your heart to serve in the pro-life community?
Well, in my probably 45-year career as an obstetrician gynecologist, I am continually amazed by God's creation, and every time I deliver a baby, what a miracle it is, what divine guidance is required to form a new human being. And the thought that people would destroy that for really no good reason was just impossible for me to comprehend.
So we didn't discuss this at all, but I talked to a lady just yesterday. I did an interview with a lady, and it'll air this month, but she found out after her abortion, she had an abortion. Actually, she had 2 abortions. And then later on in life, she actually delivered a lot, had children that she wanted. And she found out later that the same doctor that aborted her first child is the same doctor that delivered her technically 3rd child. And it was so hard for her to comprehend how this man who had been so cold-hearted in her abortion experience, never even really spoke to him, was able to abort her child, but then later, and as far as she knows, no salvation had occurred or change of heart, and was then later able to deliver a live child. And again, even visiting with her and knowing you and your heart, I can't imagine how a physician, an OB doctor, can in one hallway take life and in another hallway deliver life. And in your medical experience, do you have any kind of experience in that? Did you know doctors that performed abortions and delivered babies?
Oh, there are many of them, and I don't see how when you get in medical situations and you're trying to protect the fetus, and then you walk in the next exam room and you're destroying one. I don't know how there's just a mental disconnect somehow. I don't think they really are reflecting on what they're doing. I can't explain it.
Yeah, well, it was very unusual for me to hear that story yesterday.
But it is not uncommon. Yeah. It is not uncommon.
Wow. So just kind of a question, do they cover abortion procedures in medical school? I mean, are you taught how to do abortions?
In medical school, well, I went to medical school a long time ago, but per se, we're not taught how to do abortions, although the technique is basically similar to the technique that you would do in what we call an incomplete abortion, when a patient is having a miscarriage and has lost part of the fetus or the placenta and requires a D&C to remove the rest. I mean, the procedure is technically the same, but most of the training in abortion per se would come in an OB/GYN residency.
Wow. And so is that something that you kind of are forced to work through, or as a believer and that someone who does not stand for abortion, are you able to kind of stay out of that part of the training?
Well, when I did my residency, again, abortion was illegal in most states, so we weren't forced to do that. Now I think it's getting more difficult to claim a conscientious objection to the procedure. I'm sure residents now face a lot more pressure to do this, whether they agree with it theologically or not.
Sure. Yeah, absolutely. Okay, let's talk about just for a minute the actual performing of abortions. And so many times, like so you know my story, I've had 2 abortions, and I don't say that to brag. I know the truth of how devastating it is. I believe the lies. But when I had abortions, there was really no such thing as what they call a medical abortion now, which is basically, I think it's called the RU486 drug. And so many abortions up to, I believe, 10 weeks now are really pressured to have what they're calling the medical abortion, where they take this prescription drug that terminates the pregnancy, ends the baby's life, and then empties out the womb. Is that correct?
That's correct.
So I've also, I've been aware of the reversal drug. So this is kind of a twofold question. Can you share with the ones that are watching tonight the consequences that can come from the RU486 drug, and then also about the pill reversal, because there's a lot of controversy. First off, about the RU486 is that it's sold by Planned Parenthood as a more natural way to end the baby's life. They compare it to a miscarriage, which I think is disgusting, because no woman who has had a miscarriage thinks that it's an easy process either. But then on the flip side of that, I've had several clients that have come into my office that had wanted to take the pill reversal, but they were told that it would not do anything. So can you kind of talk to us a little bit about those 2 scenarios?
Well, basically, let's talk about the hormones, women's hormones to begin with. The 2 primary women's hormones are estrogen and progesterone. Estrogen is what causes women to ovulate, to make eggs every month with the potential of becoming pregnant. And progesterone is the hormone that sustains that pregnancy up until 11 or 12 weeks. The progesterone made by the ovary sustains that pregnancy up till 11 or 12 weeks, when the progesterone made by the placenta takes over and maintains the pregnancy until delivery. So RU486 is a very potent anti-progesterone. So it blocks the action of progesterone in preventing abortion, miscarriage, and after the RU486 is given, then, which is used up to 11 weeks of pregnancy, after the RU486 is given, then 24 to 48 hours, medicine called misoprostol or Cytotec is placed in the mouth, in the cheek, that causes uterine contractions and expulsion of the fetus and the placenta. So if a woman takes the RU486 and regrets her decision, studies have shown that if she does not go ahead and use the misoprostol, that 50% of those pregnancies will not be affected.
Wow.
The good news is that RU486 is not what we call teratogenic, so it doesn't cause birth defects. So if a woman decided not to do the Cytotec and maintained her pregnancy, there's no higher incidence of birth defects, because basically by 8 weeks, all the fetal organs are already formed. So you can't get a heart defect in a heart that's already formed. So the good news is that's not a concern. So since RU486 is an anti-progesterone, in theory, taking oral progesterone by a medication called prometrium could reduce those odds of 50% to lower. Studies have shown it might give you a 10 to 20% reduction, but there are some risk associated with the rescue pill. Progesterone is a relaxer of the uterine muscles, so if you did begin to bleed, there's a chance that you could bleed a lot more. So it's something to consider. It's readily available, but it's not without risk, and probably does not give some tremendous benefit. It incrementally increases the chance of maintaining a pregnancy, but it doesn't do away entirely with the effects of RU486.
Wow. But thinking if a woman takes the initial pills of the RU486, but does not finish the second set of prescriptions, then she has a 50% chance of having.
Maintaining her pregnancy, yes.
Wow. And see, women are not told that at all. I mean, they're told the exact opposite, actually, and it's absolutely devastating. What about physical complications that come from either medical or surgical abortions?
Well, anytime you have any type of surgery, and surgery on the uterus or medical abortion is no different, there's a risk that all the products of conception, the fetus and placenta, are not expelled, and that sets up a site for potential infection, which can cause infection not only in the uterus and fallopian tubes, which could result in sterility or increased risk of ectopic pregnancy. It could actually cause a life-threatening infection called sepsis. Admittedly, that's rare, but it is potentially possible. The other risk to surgical abortion is a condition called Asherman syndrome, where basically they go in and scrape the uterine lining. Sometimes they scrape the entire uterine lining, so a woman never has periods again, and it's impossible for them to get pregnant without a uterine transplant. Plus, in surgical abortion, some studies have shown an increased risk of preterm birth and subsequent pregnancies, because basically, natural labor, there are hormonal events that cause the cervix to soften and dilate slowly. In surgical abortion, it's just done by sheer force, which weakens the cervix and potentially prevents it from opening, potentially causes it to open earlier in a subsequent pregnancy and cause preterm birth.
Now, we didn't talk about this before we met, so you may not be prepared for this question, and that's okay. You can just say you don't know. But I've heard and I've read studies where they link abortion to breast cancer. Are you familiar with that at all?
Yes, I am, but I don't have the statistics right in front of me, so I really can't comment intelligently on it.
That's okay.
I believe in the back of my mind that women that have had multiple abortions are at increased risk for breast cancer, but the magnitude of that risk, I just don't know off the top of my head, BJ. I'm sorry.
That's okay. And I think, I mean, and you can correct me if I'm wrong, but for me, so many times when I read statistics anyways, I feel like they're so skewed because so many abortions don't get reported, first of all, and then so many complications that could potentially come from abortion. Women don't tell the truth of how many abortions they've had. I mean, even for years myself, when I would go to my OB and you have to fill out the forms about how many pregnancies you've had, I never counted my abortions. I for sure never counted my second abortion. I mean, that was like just the worst of the worst I could have ever done. And so had something come up in complication to my abortions, no one would have ever known that it was from my abortions necessarily, because I would have never told anybody that I had ever had an abortion. I would have denied it to my death. And so how do you, I mean, do you think that's common with your practice in the past? Were women open about the abortions that they had, or do you think they were more secretive?
I think they were more secretive. I think it's, maybe a different relationship that they were in that they don't want to acknowledge, or just the shame of having an abortion and the guilt they feel about it. It's not something that was frequently discussed.
Yeah.
So I think it's really underreported. So it's hard to get reliable statistics, because a lot of these events, abortion occurs in 20, 30 years olds, breast cancer occurs in 50-year-olds. So
right.
It's hard to get reliable data.
Yeah, I would kind of second that. That's my opinion. Again, I have nothing to base that on other than just almost every woman that I know, they all share the same story, that they don't tell the truth about their abortions for many, many years. And
let's look at one other thing about breast cancer. It is commonly thought, because pregnancy is such a high estrogen environment, that if a woman is diagnosed with invasive breast cancer and is 12 weeks pregnant, that she ought to terminate that pregnancy to improve her chances of survival from breast cancer. Studies have shown that that is simply not the case.
Wow.
Ending a pregnancy has no effect on the survival rate of breast cancer. And women who undergo, well, and you would say, well, I have to undergo all this chemotherapy and it's going to cause birth defects. Once again, that baby is already formed. So it can't cause a birth defect because the organs are formed. Now, it may cause what we call small for dates or intrauterine growth restriction, but that happens all the time. That happens with high blood pressure on its own. So
Wow.
the idea that pregnancy impacts diseases is just incorrect.
Yeah. I hear it. We hear a lot that people will say, I'm not for abortion unless it's for the protection of the mother's health or in the case of rape and things like that. And I say that all the time. It's like, I've never heard of a woman's life actually being saved by taking the life of her unborn baby. And I'm not saying it has never happened, but it's my thoughts and what I've been told is that that's very, very rare, if ever. Is that kind of what you're saying?
Well, I'll put it in perspective from my experience. Probably I have delivered 10,000 babies over my career.
Wow.
And when you asked me this question, I thought back. I can remember one woman that I saw in a residency who was probably 26 or 27 weeks pregnant, who had rheumatic heart disease, which is basically, it's from untreated strep throat, and it's basically been eradicated since the advent of penicillin. She had mitral stenosis and was in congestive heart failure, and she had to be delivered. But so that pregnancy did impact her life, but still there's a difference between abortion and delivery. There are conditions where, toxemia, delivery before 40 weeks is beneficial to the mother, but it doesn't destroy the life of the infant. And back then a 26-weeker wouldn't survive, but now they would. So I can say I have never seen a case where pregnancy termination saved the life of a mother. And I just did some research. Everybody's talking about COVID-19. There is no evidence that women who have severe COVID disease who are pregnant do better with their pregnancy terminated. Now, if they're 32 to 33 weeks along, they should probably be delivered to improve their respiratory function. But to say abortion is needed to save the life of a mother with severe COVID is not correct.
Wow. Thank you so much for sharing that, because it's hard to take that stand in today's world. And so I so much appreciate your willingness and your boldness to speak out, because it is very controversial. Even those people and Christians in our circles that say they're very pro-life, they still always throw in that objection, or often throw in that objection, that they don't believe in abortion unless it's for this, this, and this. And so thank you very much for clarifying that. What about, I'm looking at my notes, sorry. What about, and we touched on this a little bit, but what about, how does abortion go against the physician's Hippocratic oath? Or do you think that it does go against the?
Well, doing some research, the Hippocratic oath that I took when I completed medical school in 1974 specifically precluded doing anything to help a patient die, so euthanasia, and doing anything to help abort a pregnancy. And again, the term frequently ascribed to the Hippocratic oath is first, do no harm. In our politically correct world, the Hippocratic oath has been severely modified. So now only 14% of physicians take an oath that precludes euthanasia, and only 8% of physicians take an oath that preclude assisting in abortion.
Wow. Wow.
So that terminology has been basically removed. The rest, seemingly and not unsurprisingly, has remained intact. But those paragraphs have been removed for the most part.
Wow. Thank you so much. Well, I mean, I could just sit and listen to you all day. You have so much wisdom and so much insight and so much experience specifically with pregnancy and women. But just kind of as we wrap up this episode for our Testimony Tuesday, is there any last thing you kind of want to share to the woman that's watching, maybe specifically to the woman that is considering abortion for any reason, or to the woman that has just taken that first dosage of RU486? I mean, kind of this is, we have just a few minutes. How would you wrap up tonight's episode?
Well, I would say just like, if you were going to need any type of surgery or medical procedure, everybody says seek a second opinion. So what I would tell women is if they've been told that, their pregnancy needs to be terminated because of some medical condition that they have, they need to get another opinion, because there's plenty of women out there who have had breast cancer and who have had all types of cancer, who undergoing chemotherapy, and says, I don't care what the doctors say, I am not going to terminate, I'm not going to kill my baby. So there's enough data out there that is in what I usually do as a research thing called Up to Date. You could look, okay, I have leukemia and I'm pregnant. What effect does the chemotherapy have on my baby? And the answer is probably none.
Wow.
So get another opinion for just about anything.
Thank you. As you were talking, it reminded me, I wanted to ask you this, and again, you may not have the answer right off the top of your head because I'm springing this on you. But another argument that I hear often is for, like, if a young girl gets pregnant, and I'm talking very young, 9, 10, 11, 12 years old. And it's often said that it's a terrible idea to make a young girl at that age carry a child and deliver a child. And my argument is always, but you don't understand the trauma from abortion. So speaking on behalf of a physician, as an OB doctor, if you were to have a young girl, like extremely young, that ended up pregnant, and I would think most cases, this is a story of rape or incest, where she's been violated. Not very many 9-year-olds are very sexually active on their own accord. But if you had a young girl come in like that, what is your opinion professionally, medically speaking? Is it more traumatic for her to carry a child full term and deliver it, or to go through an abortion experience?
Well, I would say, if a 9-year-old or a 10-year-old becomes pregnant, it assumes, like we know the age of onset of menstrual periods is kind of like a bell-shaped curve. So at least they're hormonally mature to become pregnant. The pelvic bones are probably not fully developed and formed. So most of the time they're going to need to deliver by cesarean section. But I just think that that's not a good enough reason to kill a baby. I'll let your listeners, think about what they believe about rape and incest, but it's certainly not. Your question was to me medically, not ethically. I don't see any medical reason why continuing a pregnancy would be any less traumatic than aborting your baby.
Well, thank you very much. And actually, the episode that airs right before this one is from an amazing woman who actually chose life after getting pregnant from rape and never considered abortion. And it's really difficult for, of course, again, I've been traumatized by abortion, and the Lord's healed me from that. And so I come from that side of it. But to hear this woman's amazing story, who was brutally raped and conceived her child in that rape, to hear the things that people say about her precious little boy who really brought joy out of one of the worst tragedies she could imagine. It strengthened her marriage. I mean, things that, I mean, just unimaginable joy that really came from such a horrific incident. And the idea that most people, or I don't want to say most people, but many people are willing to say that that child should have died simply because he was conceived in a traumatic manner. I mean, it breaks my heart, because if you could see this family and how much joy this precious baby has brought into their lives, it would be hard to ever say that again, I hope. And that's why we shared her story.
Well, you look at the example in rape, there are two innocent people, the mother and the unborn child. Everybody right now is all concerned about innocent people on death row, but basically what you're doing is executing an innocent person. I mean, the baby didn't do anything, the mother didn't do anything. So why pay with your life when you're innocent?
Yeah. I love that. Thank you so much. Well, Dr. Sutliff, I appreciate you so much. I appreciate your service on the Care Ministry Board, and for being, again, so bold and willing to speak out on the truth of abortion on this program. And God, as we just close, ladies and gentlemen that are watching, I just want to encourage you that if you have been hurt by abortion, please call us. We have a program that is very specific to those hurting from abortion. Maybe you didn't choose abortion yourself, but maybe you drove somebody, or you paid for somebody, or you encouraged your girlfriend to have an abortion. Whatever your role was, or maybe your child or your cousin, your best friend, whatever your role in abortion is, our program is geared to help you find healing through that choice. And just remember that no matter what's been done to you or what you've done to yourself, there's always hope and healing in Jesus Christ. Thank you so much for joining us. We will be back here again next Tuesday night, 8 p.m. Please be sure to like, comment, share our videos, either YouTube or Facebook. And thank you for joining us. God bless you. Bye-bye.